As a specialty pharma focused on neuroscience and rare diseases, what do you see as the greatest opportunities and threats to your business in Canada?
At Biogen Canada, we're optimistic and we're looking at the glass half full. We believe that Canada has a lot of opportunities. The first one is really an excellence in research and development in neuroscience. We have different centers of excellence in Canada, whether you look at the University of Toronto, the University of BC, in Montreal, you look at Montreal Neurological Institute, you look at CHUM, that have in them a big number of the top researchers in neuroscience. The second thing that's a great opportunity in Canada is the diversity of the talent in this country. We can have people from many different backgrounds that can be well accepted and developed and really enrich the contribution to Biogen Canada. In terms of risk, we believe that Canada needs to become the example of developing nations in terms of providing faster access to treatments, especially when we're talking about rare diseases.
As a company committed to diversity and equal opportunity, what qualities do you describe as predictors of success for new hires?
At Biogen Canada and in biotech in general, uncertainty is the name of the game, and how you cope with this uncertainty will be the most important predictor to your success. So the first thing we look at our new hires is how comfortable they are being who they are and how they can bring all the richness of their talent to Biogen Canada.
How would you describe the state of the pharmaceutical industry in Canada in the wake of certain pharma policy changes on the provincial and federal levels?
So at Biogen Canada, we choose to be optimistic. There are things that people can interpret as negative, like the price pressures that are coming with the new regulations with PMPRB. But there's also the discussion that is a very important discussion in our society in Canada right now about the need to have equitable access to treatment and healthcare across the provinces. And we believe that the most important developments in the next couple of years will be how do we make sure that Canada becomes an example among the developing nations on how quickly Canadian patients get access to treatment, especially innovative treatment on rare diseases, which is where we see the biggest gap. So today, rare diseases access in Canada takes more than 2 years. So if Canada is going to start comparing itself with the other developing nations, we believe it should also become the example as a country for the United States, for Europe, in bringing access to treatments of rare diseases faster to the Canadian patients. And we're more than happy to partner with anybody in the authorities so that these very important changes come to the Canadian environment.